Hey, what's going on, guys? This is Tyler, pharmacist with Pharmacy Update.
Hey.
Today we will be covering the medication Ondansetron, or brand name Zofran. Just doing a quick review today, so let's get into it. First off here, what are the uses for Ondansetron? This one is pretty easy. It is used for nausea and vomiting, and it does work quite well for the majority of people. It's a pretty common script that you will see out of urgent care for people with the stomach virus. And it's used for many different kinds of nausea and vomiting, including people with a stomach bug or virus, as I mentioned, chemotherapy-induced nausea. It is usually used along with other medications to treat the massive amounts of nausea a person can experience with chemotherapy. Along with chemotherapy, it has also been used for radiotherapy-associated nausea and vomiting. And Ondansetron is also used post-op for people who are just getting out of surgery. It can be used for the nausea associated after having a surgery. Next topic here is the dosage forms that are available for Ondansetron. It is available in a tablet form that can be swallowed. However, this may not be the best option for some people, especially if you are vomiting. It could be hard to keep down. For those people, there are some different forms available. One I see very commonly is the sublingual tablet. This is a tablet that you will want to put underneath your tongue until it dissolves. These tablets can be helpful for kids or people who are vomiting. And one nice thing about this kind is it does work very quickly. It is also available as an oral film, but we hardly ever see this in the pharmacy setting. It is only available under the brand name Zofran, so I would imagine it is a little more pricey than the other options. Also available in an oral solution for young kids and toddlers. Then in the healthcare setting, it does come in the IV and also the IM solution. Next topic I'd like to cover here are the side effects.
Side effects may include nausea, vomiting, water weight gain, lower back pain, receding hairline, eczema, seborrheic psoriasis, itching, chafing clothing, liver spots, blood clots, ringworm, etc.
I want to say first off that Ondansetron is normally very well tolerated. I'd say the majority of people that take this medication don't have any issues at all. And that's one of the reasons why it is such a popular medication. However, there are some that you could experience. And I didn't mention every single side effect that is possible, just some of the more common ones. Probably the most common side effect that people can experience is a headache. This occurs in around 9 to 27% of people who take this medication. So that's one you will want to watch out for. Fatigue is also a possible side effect, with around 9 to 13% of people experiencing this. Ondansetron can also cause some gastrointestinal issues, possibly. Constipation can occur in 6 to 11% of people, and diarrhea is also possible. It is difficult to determine, though, if it is actually Ondansetron causing these issues, or if it is the stomach virus itself.
Gonorrhea, diarrhea, halitosis, scoliosis, loss of bladder control, hammer toe, the shanks, low sperm count, warped floors, cluttered drawers.
And then some less common side effects here include itchiness and also agitation in a very small percentage of people. That brings me to my final topic of the day, and that is a precaution that you should be aware of if you take Ondansetron. There have been reports of ECG changes in patients taking this medication, including what is known as QT prolongation. QT prolongation is basically when it takes your heart longer than normal to recharge between beats. This is a very rare occurrence, and even when it does occur, it usually has no clinical effect on the patient at all. However, if you are a person that has a history of heart issues, especially AFib or anything like that, you will want to use caution. Or if you take other medications that could cause QT prolongation, you will want to use caution as well. This would include antiarrhythmia drugs such as amiodarone, flecainide, etc. And like I said, this is a very rare occurrence in the outpatient setting. It is most commonly seen in the hospital when IV Ondansetron is used. So not something you want to freak out about, but still something you just want to keep in the back of your mind, especially if you fall into any of the categories that I discussed. Well, that's all I have for today, guys. I hope you enjoyed the video. This is my first time that I've tried using some editing tactics in my video. I normally just use the PowerPoint slides only, So please let me know if you thought this made the video more entertaining or if you thought it was distracting. I'm trying something new and I'd love to hear any feedback from you guys. Also, if you have any questions regarding Ondansetron that I didn't cover in the video, please feel free to leave them in the comments below. And if you'd like to see more videos like this one, please subscribe to the channel. I would greatly appreciate it. So thank you guys again, and have a great day.